Good afternoon, everyone. Thanks for joining. We're going to get started in just a few seconds, letting our speakers in now. Hope everyone is staying warm on this chilly Friday.
Yeah, it's cold.
It is cold. Awesome. Fantastic. Okay, well, it looks like our speakers are here. Cameras are on. Again, thank you for joining us for this quick 1 hour webinar on aging and future planning. I'm Allison McCain. I'm Deputy Director with the Kansas Council on Developmental Disabilities. This work really aligns with what we do at KCDD, which is to empower individuals with intellectual and developmental disabilities and their caregivers to lead systems change and advocate for inclusive, accessible, integrated communities where everyone belongs and thrives. Our council has had a really big focus on aging and IDD and the supports needed for families and caregivers through that transition. We launched a Health Equity and Outcomes Coalition in 2023, and we had several members interested in The Future Is Now. And we're really excited that Rhonda from the University of Illinois Chicago and Dr. Tamar Heller, who actually created the Future Is Now plan, are willing to do this webinar with us and give us kind of an introduction to aging IDD, and then some of the supports and resources that are in the future planning development plan. And hopefully, we'll have some folks interested in exploring it further with some opportunities to explore it further. Just some housekeeping things today. We have the setup as a webinar, so we do have the Q&A button at the bottom. You should be able to type your questions there. We'll get to them at the end, so if you want to just type them in the chat, I know for me, I have to type it out so I don't forget. So if you want to put it in there, we will get to it at the end of the hour. So without further ado, Rhonda, do you want to pull up the slides and share your screen?
Okay, thank you, Allison, and welcome everyone. My name is Randa Ibrahim. I'm a senior research specialist. I have a PhD in disability studies from the University of Illinois, Chicago, and I work at the Institute in Disability and Human Development, University of Illinois, Chicago. I'm happy to be here today with you all. Dr. Tamar Heller will join us on the second webinar on January 30th, and she will cover aspects related to aging adults with aging and disability. But today, I'll cover mainly topics related to future planning, and also Whit will be here helping me talking about family support. Um, I do want to start by acknowledging that the webinar series was supported by eGrant from the National Association of Councils on Developmental Disabilities and a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR. Okay, so to dive into our topics for today, Whit and I are going to talk about family caregiving for adults with IDD, and then we'll touch about caregiving impact, a very short overview of aging and disability, and then planning for the future and advocacy in Kansas, and some resources that are helpful for families and supporters or advocates for people with disabilities. Um, so first, I want to talk about family caregiving as a long impact, like family caregiving for adults with a disability has a long impact on the family unit. Many parents and relatives continue caregiving well into midlife and older adulthood. There's a concept of wear and tear, which is it refers to the accumulation of physical, emotional, and psychological strain from long-term caregiving. This is often reported and seen in parents or siblings of people with a disability. Some stressors related to caregiving, or like kind of like the outcomes of the stressors of caregiving include sleep disruption, financial pressure, social isolation, managing behavioral or medical needs of the person with a disability. Over decades, these stressors can increase risk for depression and anxiety, chronic health condition, or burnout, which highlights the importance of setting up supports and resources for both people with disability and family members. Also, we have another concepts that tie in into caregiving, which is the adaptation over time. And this emphasizes that caregiving is dynamic, so it's not really static. Families change how they cope and organize over time. Many caregivers develop expertise navigating the system. They also develop problem-solving skills, emotional regulation strategies, new routines that make caregiving manageable. Some report positive aspects, and I will talk about this more later. And yeah, so families usually move between stress and adaptation, so it's not really always kind of like a stressful situation. They can also adapt over time, but they still move in like different phases between stress and kind of like relaxed or more positive aspect of caregiving. So some kind of data about family caregiving, and where adults with IDD live. We know that most of them live with family members. About 72% nationwide live with family members. And we also know that most caregivers are aging, with the care most like about 41% of the caregivers of adults with with IDD are 41 years and older. So kind of like tying this data with what we know about support and services for people with IDD, we know that they are more likely to live with parents, like I said, and because of kind of like limited services availability, um, they also remain utilizing informal services. And as parent age themselves, they still remain the primary support for the person with IDD. Sometimes this can delay independent living options or supported housing. Um, but again, living at home is sometimes not a choice, but a necessity due to long wait lists in services. And many individuals with IDD require home and community-based services across the lifespan, not just temporarily. And support may usually include personal care assistance, employment supports, residential services, transportation, and therapies. And these services differ across people with disability, so not all of them might need these services. But as needs can change with age as well, services usually remain essential for community living. So they need to be long-term and stable, and instead of like short term or like given in chunks to the person with IDD. And if they want to move or change where they live, they might lose services. And in Kansas, we know that over 47,000 people are currently on the IDD waiver, all that wait list.
Oh, sorry,
And
Rhonda. I'm going to jump in here. That number is incorrect. The number is
okay,
actually 4,791.
so
So
the
yeah, an extra number got added in there somehow.
okay, that's fine. Yeah, thank you, Allison. Um, but kind of like this highlight that there's a number of people who are still waiting for services. Often waiting is an average like of 8 to 10 years before they receive any formal services. And during that time, families often fill the gaps themselves, whether it's financial aspects or physically or and emotionally. Um, and again, these long waits increase caregiving strain and um, crisis risks. So this is kind of like and knowing that most people with IDD live with families and there's an impact on caregiving, we also need to look at the support for family caregiving. And as of the fiscal year 2019, it was only 10% of the IDD service funding. So it's not a lot, which kind of like highlight that families need further support and further funding. Um, Okay, so moving into the second topic. So we talked about family caregiving of people with IDD. We also have the caregiving impact in general. And usually it has an economic impact, health and social, and positive impact, and an impact on family relationships. And these all kind of like will tie at the end into the importance of looking at services and also future planning. So first, in terms of the economic impact on caregiving, caring for a person with disability, especially those with chronic disability or severe disability, it results in reducing work hours or changing jobs. Some caregivers might stop their work entirely or take leave of absence. Um, Caregivers, according to research, we know that caregivers of individuals with IDD are less likely than non-caregivers to be employed. And they are more likely to miss more days of work and have less income overall. We also know that families of individuals with disabilities have lower saving, leading to less for retirement in terms of the caregiver saving for the future. And economic loss is greater usually for racial and ethnic groups. In terms of the impact on health and social aspects of caregiving, parents of adults with a disability usually have higher stress, depression, anxiety, and physical health issues compared to non-caregivers. There's also an impact when like they need more behavioral support or complex healthcare needs and difficulty getting services, especially for people with dual diagnosis, those with mental illness and also IDD. Um, Many caregivers identify as caring for an adult, like a parent or a grandparent, and also as a child with disability. And these we call them compound caregivers. This usually increase the stress level for family caregivers. And again, usually there's a greater impact on families of color. Um, Social networks are usually restricted or limited for family caregivers, especially those who need to care for the person with disability at home. And this impact, we need to kind of like circle back to the adaptation and the wear and tear concepts that these that the impact on caregiving change over time, especially as the person with disability age and the caregiver also age. So I do want to kind of like pause here and give like a soft reminder to everyone listening, and to all of us, whether you are a family member, an advocate, a caregiver, or a friend, a provider, don't forget to take care of yourself. That's the core of family caregiving. Okay, so I do want to say, mention here some positive aspects related to caregiving. Sorry, I think the title says health and social, but this is positive aspects of caregiving. Caregiving can be a source of fulfillment and meaningfulness. Um, a lot of caregivers reported as having satisfaction in being caring for their child with a disability. And some report better mental health, and also reciprocity in caregiving, especially to aging parents. People with disabilities are also caregivers. So the person with disability a lot of time end up caring for their parent or a sibling as they age. Resilience among caregivers associated with positive social support, higher quality of life, self-efficacy, and problem and meaning focused coping styles. So usually the positive impact of caregiving is also associated with having a support system around the caregiver and around the person with a disability, which improves their quality of life and well-being. So in terms of the impact of caregiving on family relationships, what we know from research is sisters are more involved in care of adult sibling with IDD. We also know as they get older, siblings usually jump in, help with the caregiving process. Some negative factors is that would kind of like uh, kind of I don't want to like a kind of like a disrupt but kind of but impact the family dynamic within the caregiving process is family history of depression, especially if the mother had kind of like more stressful conditions while caring for the person with a disability. However, what kind of like support and bring in more positive impact is again having a system of support for both the caregiver and the person with IDD. And sibling well-being and close relationship with the adult with IDD is also bi-directional. So both the person with IDD and their siblings impact each other, and their dynamic is really important to highlight and also consider, especially when we talk about future planning and how caregiving changes within the family and the roles within the family changes as the parents or the sibling age and also the person with disability age. And we also know that this kind of like a reality, um, whether it's positive or negative, is not equal for everyone. Some families wish that their child dies 4 minutes before they do. This is kind of like a quote from a family member because they don't know what's going to happen to their child after they pass away. So this is mostly results from a lack of future planning and not knowing what are the services that are out there that would support their child with a disability as they age, or when the caregiver is no longer available to support them at home. So this kind of like bring us to talking about aging and disability. And this is really a quick overview. Dr. Tamar Heller is gonna dive deeper into this topic on the next webinar. But just to give you an introduction here, when we want to kind of consider future planning, we also need to look at the aging system because that's where a lot of the services live. And we also need to look at the situation of both the caregiver and the person with IDD, because the caregivers usually develop chronic health conditions, so they also become in need of services. Um, and the type of service changes over time. The caregiver start thinking about retirement from employment. saving for themselves and for the child with a disability, and the caregiver might also in need of end-of-life care. And in terms of the services, we know that families' role within the school system is more formalized because the services are really structured, unlike the adult system of care. For example, among families of people with disability who wanted a specific, oops, sorry. Sorry, I lost my screen for a second there. So among families of people with disability who wanted e-specific service, over 2/3 had an unmet need for support groups, unmet need for meal services and respite. Nearly half had unmet need for assistive technology, home health care, home modifications, and training or education for future planning. So this is kind of like the gap in services in the adult system for families who are caring for adult with IDD. And as you kind of like notice at the last one, more than half of caregivers lacked training or education about future planning. Okay, so then why do we need to talk about future planning? In addition to the numbers or the kind of data that we know, which kind of like highlight that more than half of the caregivers um, don't have plans in place for the future. We know that most families are unaware of the legal and financial options out there in their states. Um, and most families fear for the future and the unknown, like the one who actually wished that their child would die 4 minutes before they do. They also usually report difficulty identifying caregiving support for the future, difficulty in initiating the process, have little contact with or mistrust of the formal disability services, lack of collaboration between aging and disability service system, which is kind of like it's right now we're working on improving, especially the connection between the disability and aging system with grants like the one who's supporting this webinar series. And again, we need to kind of look at the age-related needs and daily demands of both the caregiver and the person with a disability. So planning is related to resources, ways of coping, and options in the community. And future planning usually, especially when it's around the community or using resources in the community for families, is related to caregiving satisfaction and caregiving self-efficacy. So having said all of that, which is kind of like we have the negative aspects of family caregiving. We also have positive aspects that are usually facilitated by access to resources, finding support and resources out there, and knowing that we need to look at aging and disability, the caregiver as they age, and also the person with a disability. The research team at the University of Illinois Chicago developed a training curriculum, it's called The Future is Now, and develop this curriculum around core concepts related to families. The first one is looking at person-centered and family-centered supports and communication and engagement. kind of also highlighting and stressing that families make future plans, and supporting the families to develop letter of intent or goals for the future, and also support them in navigating the advocacy for needed for any supports that they need in the future. Um, Initially, the future is now was conducted in person, with the overall objective is to help families develop goals related to future plans. Usually, families, when they go into the training, they receive a facilitator guide and workbook with activities where they complete and fill during the training. And the training invites both the caregiver, a parent or a sibling, and also the person with IDD. So this is a joint training with the family unit. During the introductory session, we usually provide an overview of future planning and the legal and financial planning aspects for families and some resources that are relevant to them where they live. So we also help them start thinking about the big step, which is sitting down and thinking, okay, what's going to happen in the future when the caregiver is no longer able to support the person with IDD. This includes looking at relationship and self-determination for the person with disability, supporting community living, which is kind of like housing options that are out there. Where would the person with IDD live? Looking at choices such as education, work, or retirement. And usually during the training, this covers aspects related to the caregiver and the person with IDD. So we encourage the caregivers to also think about their own personal plan. What are their retirement plans? And we also we kind of like take all of these goals, whether they are related to housing options, education, work, or retirement, and we put it in one document or a package, and to keep the dream as we age, which is as the family age. So within the training, we also highlight the role of peer support. So the facilitators of the training are usually people with lived experiences. So they are either family members or self-advocates. So they kind of like give the training and also bring in their own personal stories into the training. And also the focus of the training includes community support. And we invite guest speakers who are professional in their topic, especially when it comes to financial planning, who talks more about helping the families do do that part as part of their future plan. The overall outcome of the training is the letter of intent or the future plan. This usually includes initial information about the individual with a disability, their strengths, their preferences, any interests, support needs, and their health condition, whether it's medication access, their primary doctor, etc. So families come in and start filling these information so that if anybody want to start caring for their loved one, they will know kind of like where to start. They will also know how to engage more with the person with a disability. And we also look at the goals in terms of expanding friendships and supports. So one of the activities during the training is called Circle of Support. this is where we look at what are the resources for both the caregiver and the person with IDD that are out there, and how do caregivers look at the supports compared to the self-advocates? And usually it's not really a surprise to us, but usually the caregivers would be surprised at looking at the perspective of self-advocates and how it's different from their own. Um, like identifying who are their close friends, who would they call in cases of emergencies, etc. And again, we also invite them to look at living arrangements, and education, work and retirement, and start thinking about who would be the successor caregiver. So who would care for the person with a disability when the parents or the siblings are no longer able to do so. Some of the outcomes that we found from our training, um, usually we do a 1 year follow-up. So we start by asking questions about future plan to the families before the training and then 1 year after. And we found that there was an increase in future planning activities, including writing the letter of intent, preparing a special needs trust, and initiating planning for future living arrangements. This was reported by a number of caregivers who took our training. We also found that going through the training led to a reduction in caregivers' burden and an increase in the daily choice making of individuals with IDD. And this is mainly because we invite the family as a unit to come to the training. So it's usually the caregiver and the person with IDD. We do recognize that some parents or like siblings um, can only come alone. That usually is fine as long as we know that the person with IDD will be involved in some way during the training and the planning process. So for the past kind of like 3 years, we have been working on transitioning the in-person training to virtual. Um, and we took the training, and the training is we have the topics of community support, circle of support, community living, education, work, health, and keeping the dream as we age. All of these, each of these topic is given or introduced during 1.5 hour over Zoom. So we do it over 6 weeks. Each week we meet for 1.5 hour with the families. We talk about the topic for the day, and then we give them self-paced activities, content and activities where they complete on their own, and they have discussion with their loved one, and then they come back the following session, completing some activities. We have a discussion again, and we start drafting goals based on the what the families have learned from the previous session. And all of this is done over Zoom. We utilize some resources from the ARC. It has been our partner since the beginning of the training. Um, and recently we developed a website. This will go live for our upcoming trainings that we will do with different states. And in the websites, family can access resources, um, get access to also the training material and recorded sessions so they can complete parts on their own, but also hop into Zoom sessions where they can have discussion with the facilitators and also other families and other caregivers. So again, we've been working on this for the past 3 years. we started in so eight states with I think this is for the in-person. Yeah, for the in-person, we did that in 8 states. For the virtual, we did that in 3 states, but 4 cohorts. 2 were in Illinois, um, and one was in Texas, and another one in California. And about 30 caregivers participated across the 4 cohorts. So they took the training, they came to the Zoom sessions and had access to the content. And yeah, we documented kind of like their progress during the training. Some examples of taking the big step, which is the first session that we run as part of the training, is the awareness of the need to plan. Why families need to have a future plan, why they need to write their goals, look at the resources out there. Why do they need to think about what's going to happen to the person with IDD if the current caregiver is no longer there or unable to care for them? We also discuss topics about overcoming barriers, whether it's related to caregiving stress or barriers to accessing services. We also facilitate getting the family together and family support, and discuss about elements that are needed for each family because each family is unique, and each family has different needs. So we kind of like support them during the discussions and the activity to think about what are their needs that they need to consider during the training. Um, for example, for the topics of education and work, usually the person with IDD is in either one of those. So we kind of also help them determine whether they want to think about higher education right now or education options or work. And how is that related to, for example, housing or independent living options? And again, we address self-determination of people with IDD because we include self-advocates, and part of the training is facilitated and run by self-advocates who provide their own personal experiences, talk about the resources, and talk about their future plan. And at the end of the session 1, which is taking the big step, we kind of like draft or start developing an action plan, which caregivers take during the training and fill it out to have like kind of a complete, or like the hope is to have a complete as possible for their plans. But we know that this is a dynamic document. And it should change over time. It should change with the needs as the needs of the person with IDD changes, and also the needs of the caregiver. So how to get the conversation started? And this is, again, kind of like tie-in to taking the big step and starting thinking about the future. So families can start the conversation, which is the hardest part of the plan. So sitting down with the successor caregiver or the self-advocate, and then thinking about what they want to say and what they want to know. So if they are in the process of doing their future plan, it's always helpful to know and think about what are the questions that they want to ask them, whether it's the self-advocates or a provider or the successor caregiver. Who should be part of the conversation? So do they want to invite to the future planning process? When is a good time to talk? It's also kind of like thinking about when do you start this process? Where do you feel comfortable bringing this up? And when? Like when and where? Um, and then how to break the ice and be patient and realistic, especially if this conversation is being done with the self-advocates. How to kind of like talk to them about their future plan, who's gonna support them in later life, and kind of like also highlighting the issue of aging, that the caregiver is aging, and at one point they will no longer be there for for the person with a disability. So this is our second reminder for today. Again, remember to take care of yourself. Self-care can benefit you and also everyone around you. Think about if you are in a plane, and you wanna use the oxygen mask. We usually need to put it on ourselves before we're able to help our loved ones, because if we can't breathe, we can't really help them. It's also helpful to make a list of what helps you feel rejuvenated in your life and what is important for you to take time to do for yourself, especially for caregivers of people with children with a disability right now. What are the and if you are spending more time with your loved one, and planning for the future can be a form of self-care, because start starting thinking and talking about um, what is going to be available for the person with a disability in the future is really important, and it kind of like also gives relief and reassurance that the person with disability and your loved one will be supported in the future. So with that, I'm gonna give it to Wit, who will talk about her um, family support experience and story. And she will also cover parts of resources that are available and helpful for families, self-advocates, and providers in Kansas. Wit, gonna turn it to you.
Thank you, Rhonda. Can you guys hear me? Okay, awesome. So, first of all, my name is Whit, and I'm a self-advocate diagnosed with autism, and I also work for the Kansas Council on Developmental Disabilities. But when we talk about families and caregivers, like Rhonda was just saying, taking care of themselves, I want to talk about what support can look like over time, especially that sibling support. My sister and I are 4 years apart, and there was a period of my life where she was actually paid to be my personal care attendant or PCA. So she helped me with the practical stuff like cooking, cleaning, getting out into the community, and helping me think through decisions. But really, what mattered most to me wasn't just the tasks at hand. It was that I had someone who really knew me, someone who understood how my brain works, what overwhelms me, what motivates me, and what I need when I'm struggling. And that kind of support from like family and siblings, it doesn't just help us survive day to day. It really helps us plan for the future. Because like Rhonda was saying, and like Kacy will talk about next week, future planning isn't only about paperwork or services. It's about who's in your life, you know, who understands you, and who is helping you practice like independence while still having a safety net. And also, I want to talk about on this slide how future planning didn't rest on my sister alone. My other siblings and my mom have played huge roles in helping me imagine a future, talk through hard decisions, and really kind of figure out the kind of life that I want. So they've helped me think about work, housing, mental health, relationships, and all the things that just don't show up neatly on a form that you may fill out. So when we talk about future planning, I think that it's very important that we talk about family and sibling support, not as a backup plan, but not as a backup plan, but as a partner in building a life that makes sense for the person that's being supported. Next slide, please. So, this slide's, um, I've got a lot to say about this because after talking about the people who support us, so our families, our siblings, caregivers, I want to talk about some of the tools that help make future planning possible. And Kacy's going to talk more about this next week, really, really in depth. Um, but two of the big tools that I want to highlight are the Kansas ABLE program and Special Needs Trust. For me, learning about ABLE accounts changed how I thought about my future because I have an ABLE account, and before that, before I had an ABLE account, saving money really felt like a risk. Like I was like doing the right thing, which is saving money, could actually hurt me by putting my benefits in jeopardy. But ABLE accounts give people with disabilities a way to save and spend money for things without losing benefits. And that's honestly huge because it's not just a savings account, it's a way to plan for your future, for adulthood, for independence, and long-term stability. And then special needs trust are another important piece that Kacy will talk about next week. But really, I want to say for this slide, what matters most is that these tools work best when conversations start early and include the person with a disability. Because when we understand our options, when we as people with IDD understand our options, we're more able and more likely to make informed choices about our own lives. Um, and I also want to say on this slide that future planning isn't about preparing for something bad to happen, you all. It's about preparing for a full life for the person with support, security, and choice. Next slide, please. Okay, so another really important area of future planning is something called supported decision making. And I just found out about supported decision making like this year when I started. Well, I just found out about supported decision making when I started working. But basically, and I'm so upset that I just found out about it. But basically, supported decision making means a person with a disability can make their own decisions, but with support from the people they trust. Um, that support might look like helping understand options, talking through pros and cons, or explaining information in a way that makes sense. It's an alternative to guardianship. It's guardianship is where someone else makes decisions for you, and then supported decision making is about autonomy, dignity, and us being recognized as the experts in our own lives. Now, I want to be transparent in saying supported decision making isn't a law yet in Kansas, but that does not mean that work isn't happening. We have our self-advocacy day at the Capitol next week, where we're going to be informing over 100 self-advocates about supportive decision making and giving them the tools to talk to their legislators about why supportive decision making is important. There is a Kansas Supportive Decision Making Coalition that you can be a part of. And then also, the Disability Rights Center of Kansas has a great webpage that explains supported decision making in plain language, and they even have a video that I like. So, even without a formal law, supported decision making can still be practiced every day when you think about future planning. It can be practiced in your family, in the systems that you and your loved ones are a part of, and in how professionals engage with people with IDD. So, to end for this slide, I think I want to say that planning with people is always better than planning for them, and that's what supported decision making is. Next slide, please. So, like I said, at KCDD, the Kansas Council on Developmental Disabilities, we have Self-Advocacy Day coming up, and we created a sample supported decision-making agreement form. And this is just pages 1 and 2 of that form that we're going to show the advocates next week or 2 weeks. Next slide, please. So, another critical part of future planning is self-advocacy. Self-advocacy is about people with disabilities speaking up for themselves. But in order to speak up for yourself, the self-advocate we have to know ourselves, understand our rights, and then we can use our voice to speak up for what we want, need, and deserve. It's about being involved in decisions and not having others decide for you. So at KCDD, we support self-advocacy through our Change Agent program. And this is spearheaded or led by Lola, who's a self-advocate, and it's for self-advocates. And it really just creates a space for people with disabilities to build skills, share their experiences, and learn how to advocate, not just for themselves, but for their communities. The Change Agent program also helps self-advocates get involved with the with our legislative priorities. We also have SAC, or the Self-Advocate Coalition of Kansas, which is a great organization too for self-advocates, and it's led by self-advocates. It's awesome. It brings self-advocates together from all across the state to connect, learn, and work on issues that matter to them. So, you may be wondering, what does self-advocacy have in common with future planning? And really, it goes hand in hand. Because when people with IDD are supported to advocate for themselves, we are better equipped to plan for our future, whether that's around work, housing, finances, healthcare, or relationships. So I guess my question is your family member with disabilities involved in self-advocacy? And if not, could you send them to our KCDD Change Agent program and SAC? How could you support them getting involved? Next slide, please. Okay, this is my last slide. And it's an area of future planning that I want to talk about is housing. Because where we live shapes how we live. And I know that to be true for my own life. For people with intellectual and developmental disabilities, though, housing doesn't just happen. It usually requires planning, support, and time. So, in Kansas, one important resource connected to housing is the IDD waiver, or the Home and Community-Based Services. They pay for supports to make it possible for people to live in their own homes or in the community, not just in more restrictive settings. So these supports might include personal assistance, help with daily living, or services that support independence. Now, like Rhonda said earlier, there is a wait list for this service. So If you are not on the IDD waiver waitlist, I do recommend that you contact your local CDDO or Community Developmental Disability Organization and inquire about getting on that waitlist to receive home and community-based services waiver services. Oh my gosh, so many words. But housing and oh, before I forget, another key resource is a benefit specialist. Benefit specialists help people understand how working, saving money, or changing housing could impact their benefits, like Social Security, Medicaid, or even a housing voucher. So that guidance is really good. But housing and future planning are really connected. Decisions about where you live affect employment, transportation, finances, mental health, and community involvement. So, starting these conversations early matters, um, especially because when a crisis comes, the decision is rushed. When you start early with future planning and housing, you're able to, yes. So, when people with disabilities are supported with the right information, the right services, and the right voices at the table, housing becomes more than just a place to stay, in my opinion. It becomes a place where we can really build a life. And I love it. I love where I live. I used to hate where I lived, and that didn't make me want a future plan. Now I love where I live, and I'm excited for my future. So there are some housing resources out there, and sometimes you just need to get the right resources. And there are other resources than these two resources out there. And so my birthday is tomorrow.
Happy birthday, Wit.
Happy birthday.
Happy birthday.
Yeah, well, thank you, Whit, for kind of like this great conclusion of our talk about future planning. Just to kind of like summarize and recap, we know that parents and families continue caregiving well into midlife. Future plans need to be done with the self-advocate and the person with a disability, not just around them. Like what kind of like shared her story and also the importance of involving self-advocates in the plan, start early as possible, and talk about what are the resources and services out there, and be involved in the advocacy process. Um, so yeah, I think we can pause here and see if we have any questions. Yeah, I don't see questions in the chat. Is there another place for questions, Allison?
No, I didn't see any questions. I did see at the beginning, though, we will be sending out the slides and the recording. I know there were a lot of links and resources that we shared in the slides today, so we'll be sure to send that out so you can review later.
Yeah, sounds great. And I'm looking at the time where it's almost 1. It's 12:59. So just a quick reminder that next Friday, January 30th, we will have the second webinar, which is engaging with aging, the future planning process, where Kacy and Tamar Heller will dive deeper into topics related to financial planning. Kacy is going to cover financial planning, and Tamar will talk more about sections of future planning, include bridge engaging with disability, why talking about health is important in future planning, and some resources also in the community that's helpful for family members. I do want to kind of like lastly mention that um, the Futures Now training is right now live, and we can do e-cohort with families from Kansas. If you are interested in joining e-cohort, please email me and let me know, and I will send you the information and the forms to fill out to kind of like start the process. And again, thank you all for joining us today. And yeah, I look forward to hearing from some of you or all of you.
And be sure to join next Friday for Kacy and Dr. Heller's session of the webinar series. Thank you all.
Thank you.